Hi, I'm Abbie, and I interned at the Utah Valley Family Support and Treatment Center located in Orem, Utah. It is a nonprofit organization that focuses on preventing and treating child abuse and other family traumas. And so there's the treatment side, so they do a lot of play therapy, they do sand tray therapy, family therapy, individual therapy, and couple therapy. And then they have the prevention side, and so that main focus is on education. And so they have an educator that will go into the schools and present on different topics. And then they have parenting classes that are free to the community. They have a trauma class that teaches about the effects and symptoms of trauma. And then they have a program that's adoption respite. So that's when we go in home to families who have adopted out of foster care. And it's just respite hours or break hours. And so it's just when they can practice self care. And then we have our crisis respite nursery. So as an intern, you'll have a lot of freedom. You really get to choose what to invest your time in. And you get a wide variety of different areas of social work. And so you really can learn a lot about what area you could be interested in possibly. I have absolutely loved it here. Everyone is so kind and welcoming. They really want you to learn. And so I have learned a ton from each coworker that I've been with. So you'll have the opportunity to work with the parenting classes, the education specialist. You'll attend the trauma class. You can work in the nursery, work with the adoption respite. So you really get a well-rounded internship, and I have absolutely loved it. And I would highly recommend going there if you get the chance, because it was one of the best experiences I've had. So.
Hi, I'm Cassie. I'm the parent advocate here at the Family Support and Treatment Center. And I teach parenting classes to families in the community to help them get their children back in the home or to keep them in the home. My curriculum is 11 weeks long, and we teach the Love, Limits, and Latitude curriculum. It's similar to Love and Logic. It's a relationship-based curriculum. So I offer these classes in home to parents who maybe have transportation issues or have a hard time getting to class, and so I will go into their homes and work with their specific situations. And then I also offer group classes throughout the community, working with domestic violence shelters, drug rehab centers, and then on-site classes.
I'm Jenna Labrum. I'm an education specialist here at Family Support and Treatment Center. My job is to go into schools and give presentations on mental health, so like stress management, depression and suicide prevention, and then another big thing I do is child abuse prevention. So I also talk about different types of abuse and how to recognize abuse and where to get help. We also talk about abuse within dating relationships and some parenting skills as well to help students know how to interact with children in a more positive way. So I mostly do those presentations in junior highs and high schools, but I also do some presentations to elementary kids on body safety and boundaries and what to do if someone's making you feel uncomfortable, and how to get help and things like that. So that's my main job. I also run the social media for the organization and do some public relations stuff for them, but I love my job.
Okay. The Crisis Respite Nursery is our foundational program. It's the program that's been here the longest, and it is a free service for any family in the community to use. We will take kids from newborn up through age 11. Crisis is our number one priority, and for crisis, that's typically going to be something that can't safely wait. So although crisis is our number one priority, it's not what we see the most of. Most of our families are using the nursery for things that can be scheduled. So maybe they're attending a parenting class here or somewhere else. They come for therapy here or somewhere else. They have a job interview, those types of things. Then the last thing that we allow families to use for, and that I feel is actually super important, is what we call respite or break hours. And that is typically a once a week 3-hour block of time where they schedule their kids to come either the day that they're calling or for the next day. And that isn't for something specific like an appointment, that is more about self-care. Respite is just taking a break.